Hello, everyone. It's April 4th. I'm Dr. Adam London, Director of the Kent County Health Department, working from home again today. Actually, I'm working from the deck behind our house, and like so many of you, trying to get an awful lot done, a lot of important work from home. Most of our team at the Kent County Health Department is actually doing our very best to work remotely, like all of you, trying to make it as difficult as possible for this virus to spread from person to person, and that includes us. And so we're doing our best also to work from home. Quick update on our numbers. In Michigan, as of the last report, there are 12,744 cases of COVID-19 statewide. That's an increase of 1,953 from the previous day, and we're now unfortunately up to 479 deaths statewide. Here in Kent County, we are, as of this morning, at 148 cases in Kent County, which is an increase of 13 from yesterday and 2 deaths. And so we're looking at our numbers, we're trying to find out if we're flattening the curve, if we're having an effect. And to be clear, it's too early to make any conclusive statements about that, but I am somewhat encouraged. The governor's executive order to stay at home went into effect on March 23rd. Now, it takes about 7 days for us to see what kind of effect that's going to have, or at least to start to see what kind of effect that's going to have, because of the incubation period of the infection and because of the delays in testing. So over the past 5 days in Kent County, we've seen increases in cases of 12, 11, 6, 11, and 13. So it appears as though we're seeing a fairly steady rate of increase day over day. Compared to the state of Michigan as a whole, which has seen increases over the past 5 days of 1,010 cases, 1,113, 1,679, 1,470, and yesterday, 1,953. So statewide, we're seeing day over day pretty significant increases. While here in Kent County, fortunately, we're still seeing a fairly steady rate of increase day over day. But I want to encourage you that this is not the time to lay off our social distancing. An epidemic is a little bit like a fire, and a fire is very easy to stop when it just begins. You know, if you start a campfire, a cup of water can easily extinguish it in the first few minutes. However, once that fire really starts to get raging, it takes a garden hose or a shovel, much more extraordinary tools in order to stop it. And ultimately that fire will burn, and if it's not stopped, it will burn until all of the fuel is exhausted. And with an epidemic, the fuel is susceptible people. It's people who have no immunity to that virus. And that's exactly what we all are right now. Because this is a novel virus, we're all seeing this for the first time. It's seeing us for the first time. We're all like dry wood to this virus. And that's why it's very important that we're all spacing, social distancing. We're trying to avoid too much gathering in public, just going out for those essential services, and that's about all. We also saw yesterday that the CDC is changing its recommendation on masks. The CDC is now recommending that people going out into public wear a cloth mask. We're still looking into that. We want to make sure that we're very careful in the information that we provide to you. Expect that we're going to share more information to you very soon about that, and along with information about how to obtain those masks and how to use them. Masks are a tricky subject. We know early on there wasn't a lot of data to support their value, and we wanted to make sure that we were making them available for the first responders and the healthcare workers who need them the most. Now that we're seeing some more evidence showing that you can spread coronavirus before symptoms develop, masks may be an important tool, not for protecting ourselves from virus that may be coming to us, but if we're sick or we're carrying the virus but we're asymptomatic, from preventing us or reducing the risk that we're going to spread that virus to others. So like I said, we're still looking into that. Lots of details we need to find out, and information about how you can most effectively and safely use those masks without creating additional problems or risks of exposure for yourself or your loved ones. That's it for today. I'm Dr. Adam London, Director of the Kent County Health Department, reminding you to stay positive, stay heroic, and stay at home. Thank you, and have a great day.